Welcome back to this edition of Freedom and Prosperity Radio, the weekly radio news magazine that we put together here at the Virginia Institute for Public Policy. My name is Joe Thomas, and our next guest is going to take us into a story that next to no one has covered. Yet it has been presented to me, and I was looking into it, and it seems to be a righteous argument that President Trump, through an executive order, has perhaps begun unraveling some of the things wrong in our healthcare system that go back long before the Patient Protection and Affordable Care Act was ever discussed. To take us into it, Senior Fellow for Health Policy Studies at the Heritage Foundation, back on the program, Dr. Bob Moffit. Dr. Moffit, thank you for taking some time out with us to talk about health. Now it's called health reimbursement accounts, correct?
Yeah, that's right. Health reimbursement accounts are part of the current law. What has happened here is really profoundly interesting and potentially very, very significant. Back last October, back in 2018, October of 2018, the Trump administration issued an initial announcement saying that they were going to work on a major regulatory change that would be effective 2 years hence, January 1st, 2020. So this is a product of a lot of work, a lot of thinking, and a lot of analytical work, especially among the lawyers, about what they could do. What they wanted to do was to take advantage under current law of something called health reimbursement accounts. Now, health reimbursement accounts are often available to employees in job-based health insurance coverage. They're commonly the accounts are not flexible spending accounts, and they're not health savings accounts.
Okay,
that's an important point because this is an employer-based system, the health reimbursement account. You can't, in other words, simply take the health reimbursement account with you like you can take an HSA. But here's the point. What these things do right now is that employers offer them, and if you want to buy something that is not covered by your health plan at the place of work, or you have extra medical expenses, or you have out-of-pocket medical or dental cost or vision cost, you can use your health reimbursement account to cover those costs, and they're tax-free, okay? So it's an employer-sponsored account, which is tax-free, that people can use for medical expenses. Now, what the administration is doing, what the Trump administration is doing, is something that is frankly a radical break from current policy. What the Trump administration is saying is that workers and their families could use the employer contributions to these tax-free health reimbursement accounts to buy health insurance on their own if they wish. Now, who would do that? Well, you have many firms where you have small business owners who really can't afford to offer a standard group health insurance coverage, right?
Right.
But they could afford to help offset the premium costs of employees' health insurance coverage. And this is what the Trump proposal would do. It would enable small businesses in particular to put money into an account tax-free, basically, and allow individuals and families to buy health insurance outside of the place of work if they wish to do so.
Right.
And they would be able to do that tax-free. Now, here is the key point. It's the tax-free purchase. You and I and anybody else who gets health insurance through the place of work, we have an unlimited tax break for that health insurance. It doesn't make any difference, you know, how much that your health insurance plan costs. If it costs $20,000 or $25,000, you know, it doesn't make any difference. Right. That's tax-free. There's no cap on it. What this does is basically apply the tax advantage of the existing federal tax law to the health reimbursement accounts and opens up the possibility for people to buy health insurance on their own. In other words, personal ownership of health insurance, which you can take from job to job without a tax or a regulatory penalty. I don't think you're right. I don't think that people really fully grasp what Trump has actually done here. I don't think they understand it, but I think the Trump administration has made, the Treasury Department has made estimates that as many as 800,000 employers could, once they grasp this, sponsor health reimbursement accounts, and would affect about 11 million employees.
Well, that's and without having to go through the clunky website of Obamacare.
No,
Doctor,
it's all done through the private sector. It's all private sector.
So, and then if you have particular needs, or if you have a need for a health insurance policy that addresses certain things or takes into account certain things, this puts that tax advantageousness on that, and it doesn't limit you. Again, you talk about pre-existing condition rhetoric that often swirls around the healthcare debate, but it seemed to me in the stories I was reading about it that this goes into tax policy that goes back decades in building the HMO world that has really, in a lot of ways, at very least calcified the medical industry, if not crippled it.
Yeah, the current tax policy governing health insurance was actually created during World War II in the midst of a war. It had nothing to do with health policy. It had everything to do with compensation. What happened, you had 14 million men under arms. Businesses and labor couldn't raise their health, they couldn't raise wages because of the national wage and price control system. So Congress and the IRS basically gave workers and employers, business and labor, an option, which is businesses could offer health insurance at the place of work, and it would be tax-free. That was basically to provide some relief from the wage and price control system that was established in the 1940s. With the end of the war, the price control system, of course, was eliminated, but the tax policy stayed. And and look, let me be clear about it. The current tax policy for employment-based health insurance has been a tremendous boon for millions of Americans. The problem is, if you're in a small business where your employer cannot offer you health insurance, or if you have to, if you try to buy health insurance on your own in the individual market, and under Obamacare, if you make over $50,000 a year as a single worker, you get nothing. You have to pay, in after-tax dollars, and that can add anywhere between 25, 30, or 40, or even 50% more premium for the same package of benefits that you would have gotten if you would have gotten it through the place of work. Now, let me make a fundamental point here, because I don't want there to be any misunderstanding about this. The Treasury rule is a big rule, but it can only go so far. The problem that we have is that in the individual market today, that entire market, the individual market and the small group market, is directly controlled by the Obamacare law, which means that all the benefit rules, all the regulatory rules, all the rules, regulations, and guidelines that govern Obamacare limit the kinds of health insurance you can get outside of the place of work. Now, however, what Trump did last year is open up something called the short-term limited duration plans.
Right.
And these are comprehensive plans, but they're only for limited duration. What he did is he reversed Obamacare's restriction on them. And he can do that under the law, and allow people to renew coverage in the short-term plans up to 3 years. That's a big change. But understand this. This is a regulatory change. It's a very positive regulatory change. But the fact of the matter is, the states still, the insurance markets in the states are still controlled by the federal government. If the states could liberalize their insurance markets, Congress could enable employees using HRAs as a vehicle for tax-free premium payment and choose among, as you indicated earlier, a wide variety of new and innovative health plans. we have a broken individual and small group market. Obamacare has made things worse. The Obamacare plans, as everybody knows, I mean, even the Democrats are not, admit this. They're hugely expensive. People are paying explosive deductibles. The choices have shrunk in almost every state in the union. Right now, 52% of all counties only have one plan, which is basically a single-payer system, whether they like it or not. And, the networks of doctors and hospitals, the provider networks, are very narrow in these plans, which means you can't have access in these plans to the doctors and hospitals that you might want or need. So, if Congress could, get its act together and, do something about the health insurance markets at the individual and small group market, we could actually have an explosion of innovation in the health insurance area, plus a very significant increase in coverage.
Robert Moffit is on with us, Senior Fellow for Health Policy Studies for the Heritage Foundation on it's called the Health Reimbursement Accounts and the tax policy that may really open this up. And one of the things that, you were talking about how Congress really needs to move on something like this. This is a Treasury advisory. This is the president saying to the Treasury, do this.
It's a Treasury rule. It's the law.
So the next president could change that just as easily.
Oh, yeah.
If we don't
This has got to be... No, I mean, what Congress needs to do is codify this regulatory change in law. They could do that. I mean, it could take 10 minutes. As Trump likes to say, this could be a 10-minute deal. But, that's right. The problem that he's got is the Democrats in Congress show absolutely no interest in doing anything like this. Instead, so many of them are wrapped around the idea of basically destroying private health insurance.
Right.
16 members of the Senate and almost half of the House Democrats want to basically put everybody into a single government plan with no alternatives, no job-based insurance, no private insurance.
Well, why have yourself in charge of something? And I think the demagoguery that goes along with this has really put American against American, because it's become almost class warfare to go into a poor community and say, well, you can't afford health care. So what they've done is they've created a health care system you can't afford, and then gone in and said, but you can't afford the health care system that they created.
Oh, yeah, no. I mean, look, the health care costs for workers, individuals, and families have been horrifying over the past 5 years. I mean, we've seen between 2013 and 2017 alone 105% increase in premiums in the Obamacare plans in the individual and small group market. Now, it is true, if you're low income, basically the taxpayers, basically cover the cost. The difficulty is, of course, is just throwing money at healthcare costs doesn't actually reduce the cost. It just simply papers them over. What we need to actually reduce the healthcare cost, and you can't do that outside of a system of intense competition, not only among plans but also among providers. Now,
yes, absolutely.
I mean, look, there's a lot right with the American healthcare system. We know that, but there's also a lot wrong with it. And what's wrong with it, for the most part, are the dysfunctions that plague the individual and the small group market.
Well, and it seems to be something that you can find manifest in a lot of industries. There are industries that don't want to innovate because they've gotten to a place and they're comfortable with the churn that they're creating in their industry, and they don't want to think about, we might need to try something different that might not work for us. Everyone likes that idea of surety, and I guess that's what we bought into. Yeah. I remember the HMOs.
I don't blame the insurance industry. The fact of the matter is that they have to operate within a very, very tight regulatory regime. So, they're functioning, and they like predictability. You know what I mean?
Oh, yeah.
I understand it. I mean, I remembered one time I talked to them about, opening up the system kind of like this, basically changing the tax law to provide individual tax relief for the purchase of health insurance all over the country, And I was in a debate. This was back during the Clinton administration. I was, fighting with the Clinton health plan folks.
Yeah.
And I was in a debate with one of the Clinton administration officials downtown at one of these in Washington D.C. at one of these fancy hotels where they have this this luncheon debate, whatever, between an administration official and
$500 a plate,
on the other side.
Yeah.
The interesting thing is, I thought I won the debate. I did.
Okay.
Because I thought I made the points. But afterwards, one of these insurance executives came up to me and said, I know all about this Milton Friedman guy, the great Milton Friedman. I think he's right on target, and I think, quoting Friedman, which is what I did, about fixing the tax treatment of health insurance. It sounds real good, but, we can't do that. And I said, why? He says, well, you would change our business model. We're not set up for this. No, I'm dead serious.
Oh my gosh.
In other words, think of it. They get together with General Motors, some major corporation, Microsoft, whatever it is. The insurance company comes in. They say to the managers of the company, the corporate executives, "Look, here's a contract. You sign it. We're cool with it. And they cover 10, 15, 20,000 lives."
Yeah, exactly. And
if
they
were in a position like auto insurance or life insurance, they would very much care about what consumers actually think about their product.
Sure, because they
but
were
the
more
fact of the matter is,
yeah.
health insurance companies don't care what you think because you're not the major decision maker.
No, and what's interesting is it's still, and I look at the practices, and you mentioned Charlottesville is one of the poster children. If we could, if it wasn't for August of 2017, I think the thing we'd be most well known for is how high our insurance spiked after the Affordable Care Act drove out so many of our competitive insurance companies. There's some 300% increase. But what winds up happening is that the surety of the now is driven away from the possibility of costing less, and you have a monopolistic approach that if Standard Oil in the beginning of the 20th century had behaved in the way the insurance companies get away with behaving, I think that we'd have a whole different definition of what a monopoly is, because they control the provider and they control the consumer, and then they sit there and talk about it being a marketplace. They tell you
it's not a marketplace. And no economist I know thinks that the insurance market.
But they sell it to the citizens as a marketplace.
It's absurd.
Yeah, and it really isn't. So, do you think we're ever going to? And I've heard the president even talk about health savings accounts. I know that they're there, and like many things politicians do, they say, "Oh, there are health savings accounts, but you have to divest from them. They're limited in scope and size." I mean, I'd like to see a world where you could develop a health savings account over 30 or 40 years of working, and you wouldn't even need Medicare when you retired because you had saved up so much as a 401k would be built.
Well, actually, you raise a very, very important question. Health savings accounts are a terrific option for a lot of people. They're not an option for everybody, and that's an important point. And they're not the silver bullet. The silver bullet, I'll be very blunt, the silver bullet on this, there is no absolute silver bullet in healthcare, but there is a big, I would call it a major nuclear bomb.
Okay.
To fix it. And it was outlined by Professor Milton Friedman back in the 1960s, and just about every major economist, most notable economist ever since that time. And that is that what we need to make the health insurance markets function as markets is you've got to stop the policy which exists today of the government picking winners and losers among insurance companies. Mm-hmm. And the biggest thing that drives the health insurance market is the tax policy that governs the health insurance market. Look, I'm not complaining about employment-based health insurance. I'm in a terrific plan myself here at the Heritage Foundation.
Sure.
The truth of the matter is, however, is if you lose your job, you change your job, you go from one job to another, you don't lose your life insurance, your auto insurance, your homeowner's insurance. You only lose your health insurance. Mm-hmm. Why? Because the insurance doesn't belong to you. If you decided to buy health insurance on the individual market, you can, but as I said earlier, you'll be paying in after-tax dollars much more for the same package of benefits that you get at the place of work. The answer to all of this, as Friedman pointed out, is individual tax relief for the purchase of health insurance. that changes radically the dynamic. That change is revolutionary.
And it seems like we're heading, in a small way at least, towards that.
That's what Trump is trying to do. That is exactly right. Trump gets it. I mean, a lot of people are complaining about Trump, but the truth of the matter is Trump really understands this. And the health reimbursement account idea it's a small step, but it could be consequential, especially for small businesses. As I said, the Treasury Department expects 800,000 employers to look at this and adopt it, and this will affect 10 to 11 million workers within a period of 5 years.
Bob, thank you so much for taking some time out with us, and it's amazing that not even Fox News has paid any attention to this. But
I think health policy is often it's neglected because a lot of people see it as boring and all that. But the truth of the matter is that it's almost 20% of the economy.
Well, and we all need it.
What we do here has huge consequences down the line.
Yep, absolutely.
And what I'm concerned about is this kind of brainless embrace of the idea that the federal government can give you high-quality health care that's going to cost everybody absolutely nothing. Free care for all, et cetera.
At least everybody right? That's what their thoughts are. Your employer isn't going to be taxed more and maybe lay you off anyway for it. Bob, thank you again so much for joining us this week on Freedom and Prosperity Radio.
Very good.
You can read more at heritage.org. And for all of us here for the first weekend of summer, thank you for joining us 2019 fashion. Find out more at tertiumquids.org. Podcasts up on our YouTube channel under Freedom and Prosperity Radio. Until next weekend, I'm Joe Thomas. So long, and thanks for all the fish.